Hi, hello, welcome to CPC ADDA. Today we will dive into the details of modifiers 51, 52 and 53. If you haven't already, please check out our previous videos where we covered modifiers 22, 23, 24, 25, 26, 47 and 50. Feel free to leave any questions in the comment section and I will make sure to respond as soon as I see them. Okay, for any additional support in your CPC preparation, my WhatsApp number is included in the description. Don't hesitate to reach out. Now let's go into today's topic, modifiers 51, 52 and 53. Okay, modifier 51 is multiple procedures, modifier 52 is reduced services, modifier 53 is discontinued services. Okay, let's go to the modifier 51. So modifier 51, as we see, it is a multiple procedures. So modifier 51 is used to indicate that multiple procedures were performed during the same surgical session by the same provider. Okay, modifier 51 is used to indicate that multiple procedures were performed during the same surgical session by the same provider. Okay, same surgical session, same provider, multiple procedures performed. Okay, modifier 51 is appended to a procedure code to signify that multiple procedures were performed during the same operative session by the same provider. It helps informs payers that more than one procedure was done and ensures proper billing and reimbursement. Okay, so same day, same operative session, same provider performs multiple procedures. Okay, so then we have to use modifier 51. Okay, let's see the usage criteria when you need to use modifier 51. So multiple procedures other than E&M services are performed during the same operative session and same provider performs multiple distinct procedures on the same day. Okay, when you notice these two, you can apply modifier 51 with the procedure codes. Okay, let's see the documentation part. What are the documents you need to see to apply modifier 51? A clear description of each procedure performed should be there. For each and every procedure whatever performed on that day, on that session, they have to give clear description for each procedure. Okay, and medical necessity for performing multiple procedures also should mention in the documentation. Okay, so let's go with the examples. A surgeon performs a cholecystectomy and an appendectomy during the same operative session. So here modifier 51 should append with the lesser valued procedure to indicate multiple procedures performed on same session by the same physician. Okay, so here they performed cholecystectomy and appendectomy, both performed in same operative session by the same provider. So we need to append modifier 51 with lesser valued procedure. Okay, so another example, you see a patient undergoes both a cystoscopy and a bladder biopsy during the same surgical session. Okay, the lesser valued procedure code is appended with modifier 51. Okay, so here you have to see lesser valued procedure you have to identify, and for that you have to give the modifier 51 when there is a multiple procedures performed on the same day. Okay, for example, you see in same day ENM services also performed, and same provider performed three different procedures. Okay, procedure 1, procedure 2 and procedure 3. I take example for procedure 1, knee arthroscopy with meniscectomy. Procedure 2, knee arthroscopy with chondroplasty. Procedure 3, knee arthroscopy with abrasion arthroplasty. Okay, so ENM services also performed and three procedures performed, all these three during the same session and with the same physician. So now let's see how to apply modifier 51 with these procedures to indicate that multiple procedures performed on same session by the same provider. First you have to code ENM service. Okay, with that you have to give modifier 25, because in our previous videos we have discussed about the modifier 25, that is evaluation and management services provided by the same physician who performed the surgery on the same day, and that ENM service unrelated to the procedure whatever performed. Okay, here that unrelated ENM service happened. For example, happened that unrelated ENM service happened on that day, so I have coded ENM code. With that modifier 25 we have to represent, right? And code the procedure 1, that is the primary procedure you have to code first. Okay, whatever main procedure will be there for that session, that main procedure or first whatever performed the procedure, that procedure you have to code first as a primary procedure code, and then remaining procedures you have to code after coding first. Okay, so first you have coded knee arthroscopy with meniscectomy. Okay, that is primary procedure. And then secondary procedure, knee arthroplasty, knee arthroscopy with chondroplasty, knee arthroscopy with abrasion arthroplasty. Okay, so ENM service you have coded and modifier 25 assigned, and procedure 1 coded, that is knee arthroscopy with meniscectomy, and second procedure and third procedure you coded again, and for that second procedure and third procedure you have to apply modifier 51 for both procedures. Okay, modifier 51 you have to give for the lesser valued procedures. Out of these three procedures, high value is knee arthroscopy with meniscectomy. Okay, for that procedure code I have coded, and then I have added other two procedures. For that two procedures you have to give the modifier 51 to represent multiple procedures performed on the same session by the same physician. Okay, so always you have to give modifier 51 with lesser valued procedures only. Okay, because whenever you are applying modifier 51 in the reimbursement part, reimbursement will go less for the secondary procedures. Okay, while assigning modifier 51 you have to choose primary procedures and secondary procedures correctly, and you have to apply modifier 51 with the secondary procedures only, that are lesser valued procedures. Okay, so now see, you can see here procedure, multiple procedures description in CPT book. Okay, this is the description you can find in CPT book. Okay, so modifiers description will be present in appendix A of the CPT book. See, let's read it. When multiple procedures other than ENM services, physical medicine and rehabilitation services, or provisions of supplies, for example vaccines, are performed at the same session by the same individual, the primary procedure or service may be reported as listed. These additional procedures or services may be identified by appending modifier 51 to the additional procedure or service codes. Okay. Note they have given this modifier should not be appended to designated add-on codes. Okay. What are the add-on codes? Any code that is having plus symbol before the code. Okay. If any code having plus symbol, that is add-on code. For that add-on codes you should not give any modifiers. Okay. Please remember that one. So now we'll go to modifier 52. So modifier 52 is reduced services. So modifier 52 is used to indicate that a service or procedure was partially reduced or eliminated at the physician's discretion. Okay. Based on the physician decision, procedure or service was partially reduced or eliminated. These things called reduced services, and modifier 52 should be applied here. Okay. Modifier 52 is appended to the procedure code to signify that a service or procedure was partially reduced or eliminated. This modifier helps inform payers that the procedure was not performed in its entirety and should be reimbursed accordingly. Okay. Physician decided to discontinue this procedure. He decided to reduce somewhat. Okay. He is not performing the complete procedure and he is stopping in between. So that time we have to use the modifier 52. Okay. See the usage criteria. A service or procedure is partially reduced or eliminated at the physician discretion. The procedure performed is less extensive than what is described by the CPT code. Okay. Whatever mentioned in CPT book about that particular procedure, that complete procedure provider not performing in this case. Okay. And he is stopping in between. Okay. See, the documentation part should be there. What are the details you need to see in that? A detailed description of the service or procedure, the reason for the reduction or elimination of the part of the service, why they are eliminating or why they are reducing the procedure, and that procedure description also should be there. Okay. So here you see a surgeon plans to perform a complete colonoscopy but is unable to advance the scope beyond the splenic flexure due to an obstruction. So modifier 52 is appended to the colonoscopy code to indicate the incomplete procedure. Okay. Here surgeon planned complete colonoscopy but unable to advance the scope beyond the splenic flexure due to an obstruction. So he did not completed the procedure. That's why we need to append modifier 52 here to reduce the services. Okay. And another example, a physician intends to perform a comprehensive skin lesion excision but stops due to patient complications. Okay. Physician intends to perform comprehensive skin lesion excision but because of patient complications incompletely he did that procedure. So here also you need to append modifier 50 to reflect the partial procedure. Okay. So about colonoscopy we can see with the image also so that you can understand better. So here you see large intestine You'll have annus, sigmoid colon, descending colon, and transverse colon, ascending colon, ileum, cecum. In usual colonoscopy procedure, you have to, it will start from annus. That colonoscope, you can see that black color wire is there, right? That is the colonoscope. Okay, that colonoscope will start from here and it will go through descending colon. This is the splenic flexure and transverse colon, and this is hepatic flexure here, and it will come to the ascending colon and ileum cecum. Till here it will reaches. Okay, so this is normal colonoscopy procedure. From here it will start and it will come, it will cross all these parts, and at last it will reach ileum cecum. Okay, till that they will perform the colonoscopy. But in previous example what we see here, this splenic flexure is there, right? Here some obstruction was there, that's why scope didn't cross this area. Okay, this area not crossed, then provider discontinued the procedure. Okay, so that will consider as incomplete procedure. Till here only he came. Okay, from here he did not see all these things, he did not see, so he did only partial services. Okay, in some cases also, if say physician started colonoscope here and he came all this way, and transverse colon also he saw, and he did not notice any abnormalities. Okay, and he decided that till here we came, but there is no abnormalities found, so other part also will be fine, so we can discontinue the procedure here itself. Like that he might think and he will stop the procedure based on his own decision. That time also we have to use the modifier 51. Okay, modifier 52. So modifier 52 is all about physician decision. Based on physician decision he will stop the procedure. Okay, this is about modifier 52. Okay, so now we'll see modifier 53. So modifier 52 and 53 are both are similar, but modifier 52 based on the physician decision they will stop the procedure. In modifier 53 based on the patient conditions they will stop the procedure. Okay. So modifier 52, this is the description in CPT book for modifier 52. Okay, reduced services. Under certain circumstances, a service or procedure is partially reduced or eliminated at the description of the physician or other qualified healthcare professional. Under these circumstances, the service provided can be identified by its usual procedure number and the addition of modifier 52, signifying that the service is reduced. Okay, this provides a means of reporting reduced services without disturbing the identification of the basic service. Okay, this is the description present in CPT book for modifier 52. So now we'll go to the another modifier, that is modifier 53, discontinued procedure. You see in modifier 52 reduced services, here discontinued procedure, there also procedure stopped in between, here also procedure going to stop in between, but this is discontinued, that is reduced. That is modifier 52 is based on the physician decision they stop the procedure, that's why that is reduced services. Here based on the patient conditions they will stop the procedure, that's why it is discontinued procedure. Okay, So modifier 53 is used to indicate that a procedure was discontinued due to unavoidable circumstances, uncontrollable circumstances, or these that threatening the well-being of the patient. Okay, due to unavoidable circumstances, procedure discontinued, or if they are going to continue, it will affect the patient's well-being. Okay, so modifier 53 is used to indicate that a procedure was discontinued due to the unavoidable circumstances or uncontrolled circumstances, or these that threatened the well-being of the patient. So modifier 53 is appended to a procedure code to signify that the procedure was started but had to be discontinued due to circumstances beyond the provider's control, primarily those that could risk the patient's health. Okay, so the procedure has been started, but that one has to be discontinued because the circumstances are not in the control of provider, and if you continue that procedure, there may be a risk to the patient health. Because of that, procedure needs to be discontinued. Okay, so let's see the usage criteria. Use modifier 53 when you have procedure is started but cannot be completed due to the patient safety concerns or other unavoidable circumstances, uncontrollable circumstances, and the procedure is discontinued after anesthesia is administered or after the surgical preparation of the patient. Okay, so after administering the anesthesia or after the surgical preparation of the patient, if they discontinued the procedure, then you have to use the modifier 53. Okay, so procedure started but cannot be completed due to the patient safety concerns or uncontrollable situations, and the procedure is discontinued after anesthesia is administered or after the surgical preparation of the patient. In these situations, you can use modifier 53 with that procedure code to represent this is the discontinued procedure. Okay, let's see the documentation part. A detailed description of the procedure should be there. A specific reason for discontinuing the procedure also should be there. Then you can use the modifier 53. Okay, let's see the examples. A surgeon begins a laparoscopic cholecystectomy but has to discontinue the procedure due to unexpected bleeding that threatens the patient's well-being. So modifier 53 is appended to the procedure code to indicate the discontinuation. Okay, here laparoscopic cholecystectomy has been started, but that has to be discontinued due to unexpected bleeding happened there. Okay, so due to unexpected bleeding, they have to discontinue this procedure. If they continue this procedure, patient health it will affect. So because of that reason, they are going to discontinue this procedure. So here to represent this situation, you have to use the modifier 53 with the procedure code. Okay, let's see the another example. An endoscopist starts a colonoscopy, but the procedure is stopped midway due to the patient's severe arrhythmia. Okay, severe arrhythmia. Because of this reason, they are stopping the procedure in between. So here also you should represent situation by using the modifier 53. Okay, you have to give procedure code, okay, with modifier 53. Procedure code you have to add, and then with that procedure code you have to give the modifier 53 to represent this situation. Okay, this is all about modifier 53. Okay, so modifier 53 description also you can see here, whatever present in the CPT book. Okay, discontinued procedure. Under certain circumstances, the physician or other qualified healthcare professional may elect to terminate a surgical or diagnostic procedure due to extenuating circumstances or those that threaten the well-being of the patient. It may be necessary to indicate that a surgical or diagnostic procedure was started but discontinued. This circumstance may be reported by adding modifier 53 to the code reported by the individual for the discontinued procedure. Okay, so this is all about modifier 53. So today we have seen modifier 53, modifier 52 and modifier 51. What is modifier 51? Modifier 51 is multiple procedures when same day, same operative session, same physician performed multiple procedures. We have to code main procedure and then other secondary procedures also we have to code, and for other secondary procedures we have to add modifier 51 to represent all these procedures performed in same surgical session by the same physician. Okay, and modifier 52 is reduced services. Okay, where physician decides to discontinue the procedure or reduce the part of the procedure, so that will comes under reduced services. So based on the physician interest, they are stopping the procedure. So and modifier 53, based on the patient reasons, they are stopping the procedure. What is modifier 53? Discontinued procedure. Why they are discontinuing? Based on the patient's condition. If they can continue that procedure, but if they continue that procedure, patient health it will affect severely, it will affect. Because of that they will stop, they will discontinue the procedure. That is modifier 53. In modifier 52, based on the physician decision, they will stop the procedure. In modifier 52, whatever that procedures based on the physician decision they are doing, that will not affect the patient's health. That is purely based on the physician interest, they are stopping the procedure. Sometimes they are thinking everything is normal, no need to check other things also, we can assume that as normal, and they are stopping that one. Like that cases will fall under reduced services. So based on that only patient receive whatever the services based on the physician provided reduced services only. Based on that only reimbursement also will issue by the insurance companies. Okay, thank you guys, thanks for watching. So if you have any questions, you can reach me at 8074502012. That's my WhatsApp number. If you have any, if you need any support or help, you can reach me at this number. Okay, I hope this video has been helpful in understanding modifiers 51, 52, 53. If you have any further questions or need any additional support in your CPC preparation, don't hesitate to reach out to me directly on my WhatsApp number. Okay, your success is my priority, guys. I am here to assist you every step of the way. Please like, share and subscribe to stay updated with more valuable content. Thank you.